Hello, 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 and welcome. I'm Sheila Balgobin, known as the Dream Decipherer, and this is Dream Your Life, Live Your Dream Live, where we talk about all things dreams. Now, today we're looking at dreams and their relationship with our mental and emotional health. Dreams can impact our emotional health and also be a reflection of our mental health. Now, if you're like the average adult, you'll sleep about 2 hours every night, and that's 2 vital hours in your life that could actually change your life, or at least indicate where things need to be changed in your life. And whether dreams are pleasant or unpleasant, they can affect your mental health as well as being a reflection of your mental health. So there seems to be a reciprocal relationship between the two. And while the purpose of dreams is not fully understood, studies do suggest that dreams can be influenced by our mental health and that which encompasses how we think, how we behave, and what we're feeling. So most of the research that looks at the connection between our mental health and dreams indicate that people with who are developing or relapsing into mental health issues will often have more nightmares. And there's some specific things around that we'll talk about in a minute. But it is estimated that some 4 to 6% of Americans have what's called nightmare disorder, where they're woken up by their whatever they're dreaming about, and they find it hard to go back to sleep. And not only that, they wake up distressed, and they have impaired function during the day, which makes sense. I mean, you're not getting enough sleep, and you've dreamt about something that has frightened the hell out of you. So research actually indicates that most mental health conditions are associated with bad dreams and nightmares, but the nature of the relationship still isn't fully understood. Now, could frequent nightmares actually be an indicative of a person's mental health risk? Well, research has been done with regard to the risk of suicide among young adults, which has been increasing, and I would say even skyrocketing in recent years. And doctors get it wrong, actually get it wrong half the time when they are estimating the suicide risk of young people. But what research has started to clue people in on is that one of the things that seems to be a correlation, there's a relationship between the frequency of nightmares and the risk of suicide. And this is starting to be included in the diagnosis with regard to assessing people's mental health risk or suicide risk. Now, there's also increasing evidence that frequent nightmares can also signal a relapse into mental health problems such as schizophrenia, bipolar disorder, what have you. So, particularly with regard to schizophrenia, and there's some relationship between nightmare disorder in people with depression and anxiety. So there really is, what we're thinking, what we're feeling, our unconscious is trying to heal itself. I mean, it's an auto-regulating system, our psyches, and dreaming is one of the ways that the psyche tries to balance itself. So if frequent nightmares are a signal that there is something radically wrong that needs to be addressed. I mean, the unconscious mind is saying, hey, hello, pay attention to this. It's important. And rather than trying to forget the nightmare, forget the problem, bury it somewhere, it would be wise, actually, to look at the issue, look at what's being signaled and flagged in that nightmare in order to be able to address it and perhaps avoid problems down the road. Now, there's something else that's interesting here is that there is also, it's how our mental health will actually affect our dreaming. So it's a two-way street. It's not just our dreams are in impacting our mental health and how we're thinking and feeling and reacting to things, but our mental health will also drive the dreams that we have. It can influence the frequency of our dreams. People with who are suffering with anxiety or depression experience more disturbing dreams, while people whose lives are pretty okay actually have more pleasant dreams. Medication can be and have an influence on if we're dreaming, how we're dreaming, and what we're dreaming about. For example, nightmares are an actual side effect from the use and withdrawal from certain antidepressants and antipsychotic medicines. So it could be the actual medication or the lack of it when withdrawing from it that provokes nightmares. But the question here really is, how do these dreams affect us in the end? Now, the effect of dreams can be from very pleasant to extremely unpleasant. It varies from person to person. It's really about the person who's dreaming. It's about the dreamer. Now, some people are more inclined to remember their dreams while others are not. Some are more inclined to actually try to understand what the dreams are saying and during the waking hours. But other people may just, have an interest in interpreting their dreams or the content of their dreams in order to understand its lingering effects once they wake up. So what research has found is that the part of the brain that does dreaming is there's something very interesting that happens. The part of the brain, the amygdala, that regulates our emotions with various hormones, apparently gets shut down when we're asleep. Now, what that means is that being that our emotional response is short-circuited temporarily during the sleep hours, particularly when it comes to bad dreams, what that means is that the emotional reaction to a dream, particularly bad dreams, is short-circuited so that we can revisit, if you will, things that are hurtful, frightening, what have you, without that emotional panic or response that in relation to the emotional content. Now, research suggests that the severity of a person's mental health condition may closely be related to how they react to their nightmares. And rather than how often they have nightmares, but their emotional response. And that goes back to the amygdala. Physiologically, that response is muted during our sleep hours. But for some people, it may be more reactive, and so their emotional response, particularly in when there's mental health issues involved, is much stronger, and therefore able to bypass that normal cutoff of the amygdala and the emotional responses. Now, we're going to take a quick look at nightmares. And while they're frightening and they will interrupt a person's sleep, they are relatively common. As many as 50% of children and 85% of adults may have occasional nightmares or report occasional nightmares. But unlike just bad dreams where things are a bit negative, nightmares will actually wake the person up, negatively affecting their sleep quality. They may find it very hard to fall back asleep. And these nightmares are very vivid, very clear, and will be remembered upon waking up, when generally we forget up to 85% of our dreams within the first 5 minutes of waking. But a nightmare impresses us so much that we remember with clarity what's actually going on. Now, there are various reasons why people may have nightmares, from suffering bereavement, a loss, during extreme stress or periods, or stressful periods, or during things that cause anxiety, or after some kind of trauma. I mean, think of soldiers coming back from combat, suffering with PTSD, post-traumatic stress disorder. Now, that also medications, as I mentioned earlier, can be a reason for negative loops that cause nightmares, as well as alcohol or drug use. And I've made the point before that when I was doing drug and alcohol counseling, there were the clients that I worked with would not dream. They did not dream. But once they stopped drinking or taking drugs, they dreamt constantly. All the content that they had been pushing down or repressing for perhaps decades all came flooding back in a constant dreams, to the point where people actually seem to be having psychotic episodes because their dream state was taking place while they were awake. Now, there is with regard to the frequency of nightmares, unlike occasional nightmares, a nightmare disorder is a mental health condition in which frequent and severe nightmares make it difficult for the person to function the next day. Not only because of the sleep deprivation, but because of the fear and other negative feelings that have been generated, so that they're dwelling on that perhaps during the day, and their attention span is reduced. Their ability to think clearly is reduced. So it not only has an impact on the person during the night, but it has a knock-on effect during the day. Now, with people suffering with depression, there's also an increased risk of having bad dreams and a tendency to have nightmares, twice as much in chance of having nightmares as people who are not depressed. Now, they will also, those dreams will often express feelings of anger. And depression is a mental health condition in which negativity takes over and makes it difficult to function normally for extended periods of time. And research suggests that bad dreams and nightmares may be more common in people with depression due to how this mental health condition actually affects a person's sleep. The less sleep we have, the less able the brain is to function normally, because a lot of the memory consolidation and getting rid of plaque and whatnot from the brain takes place at night while we're asleep. So if the sleep pattern is disturbed, then the brain can't do that cleanup work that it does normally when we're asleep. And that means the brain doesn't fire properly when we are awake. Now, also these bad dreams will affect our REM sleep, in particular, our dreaming, so that there's something between a real relationship between our depressive feelings and how they will impact our dreams, and therefore our mental health. There's almost a loop that's going on. The dreams the mental health impacts the dreams in turn impact the mental health. Now, anxiety is slightly different. It's also associated with negativity and in dreams and nightmares, both in children and adults. And in fact, nightmares are sometimes called dream anxiety attacks. And while anxiety is a normal human experience that increases our focus on things and helps the body to respond to stressful situations. But when it becomes out of proportion to the level of this stressor involved, then and it becomes a pattern over time, this starts to interfere with the person's ability to function on a daily basis, and actually can turn into anxiety disorder. There are several anxiety disorders that are actually associated with nightmares. One type is called generalized anxiety disorder, and this may be diagnosed when symptoms occur nearly every day and last 6 months or more. And research has shown that in an older adults, show that about 20% of older adults will suffer with generalized anxiety disorder and have regular bad dreams and nightmares. Now, just a brief word about stress and post-traumatic stress disorder and how that relates to dreams. And PTSD is another type of anxiety disorder that's linked to bad dreams and nightmares. I used the example earlier of soldiers returning from combat duty. PTSD develops when the normal reaction to a traumatic experience like fear or anxiety, or being hypervigilant, really watchful, begins to persist and starts to affect other parts of a person's life. Now, nightmares are a defining feature of PTSD. And where the person is basically, it's like Groundhog Day in a negative sense, that they're constantly reliving this traumatic event or events, and the emotions that were associated with those traumatic events. Now, as I said earlier, the amygdala, which regulates the hormones that are related to our emotions, is not short-circuited temporarily as it would be normally when we sleep. It becomes hyperactive. Our amygdala becomes hyperactive, and the emotions associated with those dreams, particularly negative emotions, becomes dramatized, becomes greater. Now, this research has been done around PTSD in soldiers, and they found that working with the dreams and working through the dreams actually helped to reduce the reactiveness to the original trauma. It's a slower process, and there's EMDR, which is a desensitization technique that is particularly effective with PTSD, is often used with soldiers, for example, or others who have suffered traumatic experiences of some kind. Now, with we're moving on from there to looking at people who are having psychotic episodes or suffering with schizophrenia. And dreams and psychosis seem to be related, with some researchers actually suggesting that the underlying mechanisms between the two are similar. Now, psychotic disorders are a group of mental health conditions in which a person struggles to distinguish between what is real and what is unreal. And as many as 55% of people with psychotic disorders also suffer with persistent nightmares. So, now, schizophrenia in particular is a specific type of psychotic disorder, and studies have found that individuals with schizophrenia tend to have more bizarre dreams, just really out there, often in which they are victimized in some way. Some people with schizophrenia may also struggle to distinguish between their dreams and reality, and that goes back to what I was saying earlier about like clients who were withdrawing from drugs and alcohol. Now, quite often, what has been indicated is that people are self-medicating with drugs and alcohol, and so there was already perhaps an underlying mental health condition that was never addressed or recognized. Now, perhaps in the response to some trauma in a person's life at some point. But nevertheless, when there start to withdraw from the drugs or alcohol, again, what looks like it could, maybe they actually are psychotic episodes, but it would appear they're acting as if they're having experiencing psychosis, in that if they're screaming, crying, cursing, whoever it is, that the memory that they've repressed that has come flooding up once they've stopped drinking or taking drugs, they look psychotic. They act like they're psychotic because their dream content is actually taking place while they're awake. And so they're interacting with the characters in their dreams, like I said, screaming, crying, cursing, whatever the case may be. And of course, we look from the outside, we see nothing. So that just looks like, somebody's off their rocker. But no, it's the psyche, again, trying to flag that there's a problem and get the person to address the issues that have caused this trauma, whatever the trauma may be. So there is a real relationship between our dream content and our emotional and mental health, and so that the one drives the other, or the dreams can be a reflection of our mental health, or our mental health can drive the content of our dreams. But it's in either case, I've always maintained that it is important, as in terms of our psychological balance and healing, to pay attention to our dreams, because our unconscious mind is trying to give us information to enable us to be back in balance. And when we ignore that information, it just has a snowball effect and things become that much worse. So there you have it, a bit of information about dreams and mental health and the relationship between the two. And if you're suffering with nightmares and would like to get some advice as to how they can be addressed, what's going on with that, and how to decrease the incidence of nightmares, including looking at your sleep patterns and other things going on in your life, get in contact. You can book a free, no obligation consultation to get help with a specific dream, or to get some sleep tips to help you to sleep better, and to how to remember your dreams better. So thank you so much for watching and listening. Have a great rest of the day, and I'll see you again soon. Take care. Bye-bye.